Namaste, I am Dr. Payal Khandelwal, Senior Ayurveda and Panchakarma Consultant practicing in Whitefield, Bangalore. Fertility issues and Panchakarma treatments. So here at Ayurveda First, whenever a couple visits us with infertility issues, we go into details of what issues they are going through, starting from the lifestyle assessment to the problems they have come to us with. Now, what are the different protocols that we follow here to solve your fertility issues? And what are the Panchakarma treatments that we do? Let's discuss about it. So number one is, first we categorize each and everybody problem. For example, a female's health issues, we go through the complete details of the menstrual cycle and see what is the quality of the menstrual blood that she has. So we'll ask the color, we'll ask whether it is frothy, whether it is thin, whether it is scanty. So we categorize it into Vataja. Vataja, when the wind element and the dryness element in the body has increased. Okay. For example, when the person has menstrual blood which is scanty, which is thin, which is frothy, which is light in color and which is also blackish, is extremely painful. So this indicates there is a lot of Vata in her body. So we know that she might be consuming primarily very dry food, or is doing excessive exercise, or having excessive stress, or is not sleeping well at night. Then the next issue is Pittaja blood, that is the menstrual blood. It has a putrid smell, it has a foul smell, it is heavy, it is bright red in color, and there are a lot of heavy menses issues, or she is having dysfunctional uterine bleeding. Then we categorize under Pitta, and we know what kind of food she is eating. She might be eating very spicy food, she is eating a lot of junk food or a lot of sour food like curd, tomato, pickles, tamarind, etc. Or she is not sleeping on time at night, so that is increasing her Pitta or the heat element in the body and affecting the process of fertility. The diseases which may follow is Endometriosis, Adenomyosis, or inflammatory diseases in the uterine cavity. The next which we categorize as Kaphaja. Kaphaja means again the water element in the body is more, and she may have a very thick menstrual blood, one which has clots in it, okay, sticky, and there could be a lot of white discharge she might be going through. So this is the Kaphaja category, and we know that what kind of food she might be eating is a lot of dairy products intake, okay, or she might be going through PCOD and obesity issues or thyroid disorders. So this is how we categorize, and according to that we plan the Panchakarma protocols. Example, for Vata person, Basti is more applicable. Basti is enema treatments which we give in the set of 8, 15 or 30. We will be discussing about all these treatments in the consequent videos. Second is, in Pitta female we give Virechana, that is we cleanse the body through purgation or through motions. And the next is Kaphaja, that is when she has this thick whitish discharges or the blood is not clearly flowing out, then we prefer giving Vamana. Vaman is through vomiting. Okay, so all these therapies, they help to resolve the core issues. Now there is a very important second concept that I would like to share, that is called Cyclic Panchakarma. Cyclic Panchakarma is 3 different times of the cycle where we can introduce Panchakarma treatments to solve the issues. For example, if a female has PCOD issues, if her follicles are not growing, okay, lack of follicular growth, and she is having scanty menses, or she is not having her menstrual cycle properly, then we do Vamana treatment in the cycle, that is Vaman is through vomiting. Okay. Now second issues we find out is ovulation disorders, that is the ovulation not happening on time, the ovum is reaching its size but it is not able to liberate. Then we think about Pitta issues and we give her Virechana treatments. The next part is when she is having luteal phase defect, or she is having other issues like low progesterone, or she is not able to sustain the pregnancy, then we think about Basti treatments. So these are also various protocols that we follow to resolve the issue. Now the outcome of these treatments is the natural fertility process is stimulated and we help to get good quality egg in the female. We help to get her natural menstrual cycle in a rhythm, and third is improve the quality of the menstrual blood. So remember, the next time you have your periods, remember to check the menstrual blood which you are having, and which will give us a correct insight to your Ayurveda doctor and help you decide the treatments. Also, we do advise the change in food as per requirement, which is important to correct the menstrual cycle. Now the next part of the fertility process is in males, where we do the semen analysis test as per Ayurveda. So in Ayurveda, we just don't depend on your lab reports. We also do certain investigations based on Ayurvedic parameters, again which is called Shukra Parikshan. So whether the semen, it is thin, it is very watery like, then it is because of increased Vata in the person. If it is smelling awful and there is some pus or infection, then it is related to Pitta. And the third is if it is very sticky, very viscous and is not moving, then it is related to Kapha. So if these conditions are there and we do not resolve, doesn't matter whether your semen analysis is normal or abnormal, it will still not help you achieve a pregnancy. So we need to correct again these conditions with changes in the food protocol, in the lifestyle and through Panchakarma. So in males, if it is thin semen, then we, considering Vata, we advise Basti treatments. If it is Pitta related, we will advise Virechana treatment. And if it is Kapha related, we will advise Vamana treatment. Sometimes if the condition is a combination of all this, we plan proper Virechana and Basti treatments or Uttar Basti treatments. In the next video, we will be discussing more about the Upakarmas or the various other add-on procedures which we do to improve your fertility. Thank you.